This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Well, thanks, Mark. Hello, everyone. Welcome to Caring for Kids. January 2020, a brand new year. We're looking forward to a great year of Caring for Kids. And our first episode has a great lineup of guests. We're all working very hard every day to advance the health and wellness of children and families. Joining us tonight will be Bob Enos. Bob is president and founder of the Enos Center for Children. Mario Nanos and Dr. Chad Brummett, who are both working to put an end to the opioid crisis. And rounding out our guests will be Wasim Mahfouz of Leaders Advancing and Helping Communities. It's all coming up next right here on Caring for Kids on WJR.
It's Caring for Kids with Larry Burns.
Welcome back, everybody. Larry Burns here. January 2020, our first Caring for Kids show of the year. And our first guest is in the studio. And I want to welcome Bob Enos. Bob is the president and founder of the Enos Center for Children, an organization he started in 1978. Correct?
Correct.
Throughout his career, Bob has received numerous awards and most recently was honored as a recipient of the 2018 University of Michigan Ann Arbor School of Social Work Distinguished Alumni Award. Bob continues his work at the Enos Center, which has grown to include 6 facilities with over 100 employees, serving more than 6,000 children and families each year. So, Bob, welcome to Caring for Kids.
Yeah, thank you. And thank you for having me. And Happy New Year.
Happy New Year to you. It's great to see you. And our listeners, tell us collectively about your personal journey and what led you to start the Enos Center.
Well, we started in a Center for Children, and as you said, in 1978. My journey to do it, I guess, is because I'm an unofficial foster child myself. My grandparents raised me, my uncles raised me, my parents divorced, and I kind of swore then that somehow I was going to get back to working with kids.
Right.
So I've been blessed to be able to do that in a variety of capacity for more years than I can count, quite frankly.
And so the journey of creating something like this, so how did you get started and sort of where are we today?
Well, we started, I borrowed $6,000 from an attorney friend of mine at that time. Now we do over $13 million worth of work. It's still not enough to get the job done. And as you mentioned, we are in 6 offices. Flint, we have an office in delinquency, which is not even on my resume, but across the street from me. And we service this area for delinquencies privatized in Wayne County. And our CMO partner with Spectrum Companies. We provide all the case management services for all the kids that come into care from Hamtramck, Highland Park, and the New Center area from which we set now. I guess my journey is that I just wanted kids to be, and families to be served. And as I got older in life, I guess it's kind of become my ministry. This is what I do. I love children. The system needs a lot of work still. And I've worked on it a long time, and hopefully we've improved it some, but it still has a long way to go in my view.
Well, you have improved it a lot. So we're talking with Bob Enos of the Enos Centers for Children. So you mentioned that there's 6 facilities now. I think I said serving over 6,000 children a year. Mm-hmm. So what are some of the programs that kids are going to experience when they go to one of your facilities?
Okay, we have a variety of programs. Foster care is our base program, and we have several types of foster care. We have regular foster care, which is foster care that we service and see children once a month, and those sites, which are, again, in Southeast Michigan predominantly. We also have treatment foster care, which we put 3 professional people in a home with no more than 2 of those children to intensively work with them to keep them out of institutions and give the family and the child intense services 24/7. We think that's crucial because children and families are going to have to come home, and you can't just treat them in an institution and not have that continuum of care. So we call that specialized group care. We grew into special needs adoption, and special needs only means kids in the system. We did 125 adoptions last year in that special needs area. Our goal is to, 1, create families if we can't restore those families to their natural families. And I'll talk about that a bit later, if I may. And we also do community-based delinquency, which I mentioned to you ourselves, in terms of working with children and families who have been adjudicated delinquents in the catchment area that I mentioned, and provide a variety of services with those. We found out moving forward in our system over the years that kids don't come in with identified sexual abuse as an issue. But I would guess, and I have to guess because I don't have the data to support it, that 40% of our kids have been sexually abused. And then those kids who have been sexually abused often perk on other kids. So we developed another program that's very difficult to sell, but it works because we have court involvement and consequences for behaviors, where we in fact treat those kids, we treat sex offenders. But I want people to be very clear, we don't treat pedophiles. We treat kids who've been victimized, who end up victimizing other children.
Yes.
So we do that. We also run a youth assistance program with the county, where we're trying to keep kids out of the system and families out of the system, which is obviously our goal. And so those are some of the programs, in addition to now at all of our sites, we are an approved outpatient behavioral mental health clinic.
Oh, you are? Okay.
And we just hired this week nurses to come in. We know that we're going to go to integrated healthcare. And so we want the complete continuum of services to be with us.
Right. So as I think you know, the Children's Foundation is now a community-based foundation for children and families. We're more about prevention. We're more about wellness. We're more about social determinants, which you just mentioned many of them. Kids are the way they are because of what's happened to them.
You're exactly right.
And you're trying to help that. And we now have 77 partners throughout the state. And so we're all about partnerships. And so you mentioned a couple of your partners, but do you have other partners that are helping you serve the families and kids?
We certainly do. I think it should be very clear that no one agency, in my view, or one person or one place can help everybody.
Yeah.
Without partners, to me, you're dead, because you need services that I'm not good at providing that someone else may very well be. So our other partners that we work with are Oakland. We have an official relationship with them as advocates. Oakland Family Services.
Okay, that's one of our partners.
That's one of your partners. Yep. Spectrum Companies that I mentioned. Wolverine Human Services. Orchards.
Familiar with them.
Yeah, Orchards as well. So there are 5 of us, and we do lots of advocacy and a lot of partnerships. With the new Families First Preservation Act coming into care, we're looking at trying to put together a pilot to do exactly what you're suggesting, is to do early intervention and prevention. We've been to Florida, we've been to Texas, we've been all over the place looking at what's going on in other states. When we get this Family Preservation Act approved by the feds, that we happen to be one of the agencies, 4 of those agencies I mentioned are on the transition team of the 6.
Right.
And we're recommending to the group we're in of how we might have input that would do prevention. Like in Florida, they went from worst 10 years ago to second best in the country in terms of delivering services. They went private out there, but the new law allows, under our federal funding, Title 4E, that you don't have to come into care. If you can be treated safely at home, then you can be paid, reimbursed to provide services in home, which is at least early intervention. They call it prevention.
Right.
Whatever you call it, it's a great thing because you had to be labeled something to get into the system.
Get into the system.
So now they're changing that label if the state plan's approved.
Gotcha.
And so I mentioned earlier Centene, an insurance company.
Right.
I know hopefully your foundation is working with that group because we feel we must, because 34 states now have insurance companies managing their risk. And when you pay $17.6 billion to buy Meridian, we're going to be dealing with insurance companies and how we deliver services for children in this country, or in this state, in this country, I believe. So that's all new territory. A ton of new opportunity, but a ton of challenges that we must work together to figure out how to make it work.
And so we're talking with Bob Enos from the Enos Centers for Children. So you mentioned a little bit about the future, but in particular to 2020, because we've started a new year, what are you hoping to achieve that you're looking forward to?
I don't know if it's new or innovative. Well, I think the new and innovative is a pilot we're thinking about doing for this new system to see if we can do early intervention prevention. That's exciting. The other thing is old but new, to me at least, and that is adoptions. We do, as I mentioned, I think 125 adoptions last year. We can do it better as a state, and I have a ton of recommendations for folks about how to do that better. We need adoptive homes. We do a better job of educating the public of the 3 different types of adoptions. One international, for which you pay for adopting out of the country. That can cost you $100,000. You know, private domestic adoptions, as we call them, can cost for infants $25,000 to $50,000 in the state. Ennis has today 200 and some kids available for adoption alone. That we got to get adopted.
Okay.
We pay, or the state pays through us, you know, age-appropriate reimbursement and medical subsidy to raise these children to age of adoption, and they're your kids. 95% of the 125 kids that we just talked about with you that were adopted by us are ages 0 to 13. Most of them are in the 4 to 5-year-old area.
So if people want to know more information and want to maybe adopt a child, what's the best way to get a hold of you?
Well, our website will certainly get a hold of us. That's at innocentforchildren.org.
Okay.
Or they can call to get any of our facilities, which are located in Genesee County, Livingston County, Monroe County, Oakland County, St. Clair County, and Wayne County. They can call 888-200-8915 and just say where they are, and we'll connect them immediately.
We'll connect. Good. And we'll post that on our website as well.
Correct. Thank you so much for that.
Well, thank you for being here and for all the work you're doing and helping kids and making their lives more fruitful and healthy. So keep it up.
Thank you.
You've just started. 1978. You've just started.
Just started. You're right. A lot of work more to do.
So that was Bob Enos of the Enos Centers for Children. And next we're going to hear from Mario Nanos and Dr. Chad Brummett about the great work they're doing to combat the opioid crisis. When Caring for Kids continues, here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Foundation.
Welcome back, everybody. Larry Burns here. As I said, Happy New Year to everybody. Now in the studio, 2 of my favorite people that I've worked with for a while now, and that is Mario Nanos and Dr. Chad Brummett. Mario is a family man and entrepreneur in the healthcare field, as well as the co-founder of the Washtenaw County chapter of Families Against Narcotics. After losing his son Yanni in 2008 of a heroin overdose, Mario dedicated his passion to providing the community with the education and resources it needs in order to promote recovery. And Dr. Chad Brummett is an associate professor at the University of Michigan, where he is the senior associate chair for research in the Department of Anesthesiology. Dr. Brummett is also the co-director of the Michigan Opioid Prescribing Engaging Network, also known as Michigan Open, which aims to apply a preventative approach to the opioid epidemic in the U.S. Through appropriate prescribing, after surgery, dentistry, and emergency medicine. And Dr. Brummett has been published more than 150 times in several top journals. And I think I'll start with Mario. And Mario, I mentioned in the intro about your son Yanni. Can you share with our listeners what you believe they should know, be it as parents or grandparents, friends, during this opioid and heroin crisis? And people need to know things, and hearing from you, I think, will be very, very powerful.
Yeah, so Yanni's Greek for John, and that's what we called him. And he died in 2018 from a heroin overdose. He was a AAA hockey player, Detroit Red Wing fan, loved everything about hockey. And it was during the course of playing hockey that he injured both shoulders. Mm-hmm. He left to go to school, graduated from high school, and left to go to school at Central up in Mount Pleasant. And while he was there, he found a doctor to address the pain he was experiencing in his shoulders. That doctor wrote him a script for opioids. Within a very short period of time, he became addicted to those drugs. And he approached several of his friends and said, I have a problem. Mm-hmm. I'm addicted to these drugs. They're expensive. I'm going to switch to heroin. It's cheaper. Don't tell mom or dad. I got my son back, thankfully, due to some of his friends who approached him. I got him back for 14 months, and it was amazing to have him back. But not long after that 14-month period, I got a text message from him letting me know he had relapsed, and I could tell that he was in trouble. And I did my best to help him from afar, but I got a call from the San Diego Police Department a few days later that he was found dead from a heroin overdose alone in a hotel around 200 feet, literally, from the Mexican border. So, what do parents and grandparents need to know? They need to take an active interest in the lives of their kids. They need to have what an expert that we brought in at FAN referred to as school connectedness. Are you taking an active interest in reading the emails that are coming to you from the school that your kids attend? Are you helping them when appropriate with their homework? Get involved. Are you getting to know the kids that they hang out with? Are you getting to know the parents of the kids who your kids hang out with? Do you know if the siblings of the family that your kids are hanging out with, what are they up to? Get involved.
Get involved.
Get interested.
Yeah. Wow. Well, thank you for sharing that story, and I know what you are taking your great loss and trying to do a lot of great work. And so part of that is the creation of your Washtenaw County FAN, Families Against Narcotics, and you've had a number of activities. You're now partnering with us, meaning we're trying to help educate people about what's going on and to create some doors being opened. And so what do you have coming up that you want people to know for FAN?
Yeah, we've got a Narcan training event coming up in February that I believe you guys are going to help on your social media platform.
Right.
So the folks can go there. I'm sure you'll link to our website, but it's a Narcan training event being led by a couple of people who I think are the best in the state of Michigan at educating on the use of Narcan. She is a professor at the University of Michigan School of Nursing. Her name is Gina Dahlem, and her partner in training is Lieutenant Lisa King from the Washtenaw County Sheriff Department. I think Chad knows them both. They're awesome people. And not only do you learn, Larry, about Narcan, you learn about the history of Narcan, and everybody who participates in that training on that day will get a Narcan kit.
Okay.
I'm going to have 200 free kits to give away on that day, and I want to have the problem
of giving them all out,
of having 300 people show up and having to find another 100.
We're going to help you have that problem.
Good. I want that problem.
Yeah. All right. So, Dr. Brummett, tell us more about Open, and you know Mario, you know the story, you've heard other stories, and so as a physician, tell our listeners about what Open's doing and maybe what your thoughts are on this crisis.
Sure. So the Michigan Opioid Prescribing Engagement Network, or Michigan Open, was started in 2016. I'm an anesthesiologist and a pain physician, and I partnered with a couple of surgeons, Mike Inglesby, who is a liver transplant surgeon, and Jennifer Walge, who's a hand surgeon. And we came together. Actually, Dr. Inglesby reached out to me. He said, Chad, I want to do work in this space. He had, in one weekend, harvested organs from 3 young people who had all died from overdose. So in the same weekend, 3 young women, all in their late teens, early 20s, became organ donors. And actually in the state of Michigan, there was about a 20% increase that year in the number of organs that came from opioid-related overdose. And so he sort of identified that as a problem. And our group was already working in the opioid space. And we sat down as a team and realized at that moment that most of the country was focused on what to do with chronic pain. With the CDC guidelines, the NIH, the FDA, everybody was focused on chronic pain, opioid use disorder, and opioid addiction. And those were all important pieces. But at that time, really no one was talking about who gives the first prescription,
Right.
and how are all these excess pills finding their way out in the street. And we really believe that acute care, so what we call acute care, surgery, dentistry, and emergency medicine, were an unmet need. And so we sought to fill that need and have shown that becoming a new chronic user after surgery, so you're not using opioids before your surgery.
Right. You have surgery, you start using them.
Yeah, that's the most common complication after elective surgery. About 6% of people who come in not using opioids become no chronic users. And the other side of it is that about 70% of what we prescribed to people not using opioids went unused. And if we project that out, 44 million surgeries a year in the U.S., we're talking about billions of pills in excess
That are in somebody's medicine
cabinet for decades. And so that's kind of how we came together to sort of fill that gap of acute care. We've expanded now. We do a lot of, we're working on the other end, doing naloxone work in emergency departments, actually working directly with Gina Dahlem and others. But that's how we really came in, and we really view ourselves as trying to fill that gap for acute care and keeping healthy people healthy.
Yeah. And so are we making progress with physicians and dentists and on the prescription side?
Absolutely, and it is something that's going faster in our state. So our state's unique in that Blue Cross Blue Shield of Michigan funds a network of collaboratives. These are every hospital in the state of Michigan, all 72 major hospitals, come together 3 times a year to talk about surgical quality. This is the MSQC, the Michigan Surgical Quality Collaborative. We partnered with them because they had a captive audience. They were already getting information from patients. And so we were able to say not only how much are people being prescribed, but how much are they using, so we could make real world prescribing recs that were patient centered, because we still care about attending to pain, and then give those back to providers. So rather than a policy limit to say you can only write 7 days, you can only write 5 days, we gave information. And actually just this last year, we've shown that in about 18 to 24 months, we've reduced prescribing for general surgery by about 70%.
Wow.
Down from an average of about 50 pills to 10 pills per prescription, and pain has not changed, and satisfaction has not changed, and refill requests have not increased. So we've done something that is patient-centered, but would project out to keeping many millions of pills out of our community.
Yeah, and then combining that with what Mario is doing of educating the non-physicians, moms, dads, all of us, about the dangers of opioids. Is going to increase our ability to help people, and so that integration of what you're doing, Chad, and what Mario's doing is key.
That's why Dr. Brummett is on my board.
Yep,
and that's why lots of other people are on my board, as well as people in recovery, because I learn the most about addiction and substance use disorder from people who are fighting that battle every day.
Yeah, and so your Washtenaw County fan is relatively new.
Mm-hmm.
We started a new year. What are you hoping to achieve with the organization in 2020?
Well, we've got an amazing lineup of guest speakers, and scheduled throughout the year. We have our meetings on the second Monday of every month, but some of the subjects that we're going to tackle, I really want to focus heavily on stigma, because that is a huge barrier to people accessing care. So we are working with some of Chad's colleagues from Michigan Medicine and the University of Michigan to bring in an expert from Harvard, Dr. John Kelly, on the subject of stigma. We have a Yoga for Recovery program that's going gangbusters, exercise for recovery that we're doing in partnership with Orange Theory. And all of these programs that we're offering, I'd like to get them further entrenched into the recovery community and into the community of people that support people in recovery. So the families, the friends of people in recovery, so that they know that these programs we're offering are out there and they're free.
Yeah, and count on our foundation to continue to help. I know you realize that we're supporting the recovery program at MSU. Last fall, they started a dorm space for recovering MSU students. We're supporting that with your friend Ken Daniels.
Yep.
And the Jamie Daniels Foundation. I have a meeting actually in the next day or so with Eastern Michigan University to see what we can do to help them. And then I also have some meetings scheduled with Central Michigan University, my alma mater, to see what we can do to help them, because this is happening everywhere, and we need, as a foundation, we need to to make sure that we're helping as much as we can and partnering with people like you. So you guys are doing great work, and appreciate you being here today and appreciate your friendship.
Thanks for having us.
Thank you so much.
My pleasure. Next, we're going to hear from Wasim Mahfouz, the Executive Director of Leaders Advancing and Helping Communities. When Caring for Kids continues, here on the great voice of the Great Lakes, News Talk 760, WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Welcome back, everybody. Larry Burns here, Caring for Kids, January 2020. Now in the studio is Wasim Mahfouz. And Wasim, hello. Good to see you.
Hello, Larry. Thank you for having me.
Happy New Year.
Same to you.
Wasim is a proud immigrant who's never taken the American dream for granted. For 17 years, Wasim has been the executive director of what's known as LAHC, Leaders Advancing and Helping Communities, and also served as assistant to the Wayne County Executive. During his time with LAHC, Wasim has implemented several new programs. We're going to hear about some of those and initiatives servicing youth, children, seniors, and families. Wasim also sits on numerous boards. He's very active in the community. I see him everywhere, and so I'm glad you're here, Wasim.
Thank you for having me.
It's our pleasure, and congratulations on so many impressive accomplishments at such a young age. I know this is radio, but I'll tell our listeners you're very young. What are you, being an immigrant, what are you most proud of so far?
I must say that I am proud probably to be a father. And the first to begin with, to two beautiful children, Rami, he's 14, and Mia, she's 9 years old, going on 19. And I feel that this experience kind of shaped the man that I have matured into today. And when you share unconditional love with people, and you want to create a safe environment for your family, you kind of take that experience and you try to apply it in your community with other people, and it kind of drives the work that you do and the programs that you offer. So you take it from a personal level to a whole community level, and it kind of drives the work and everything in between that you do. You want to create a safe environment for other kids. You want to do good in the community. You want to set a great example for your kids and other kids to follow in the community. So it all stems from that family, little small family at home.
Right. So it starts with you, then your family, and then your extended family.
Absolutely.
And I've seen it firsthand. So congratulations on that. So I mentioned LAHC, Leaders Advancing and Helping Communities. So I know you're been there. I know you're located in Dearborn. Mm-hmm. So tell our listeners who maybe aren't as familiar with the organization about the history, because I think the history is kind of interesting and important. And then more importantly about your new location and some of the things you're doing.
Absolutely. LAHC stands for Leaders Advancing and Helping Communities. We're a 501c3 nonprofit human services organization. We've been proudly serving the community in Southeast Michigan for the past 30 years. We provide programs focused on education and youth development, public health, and social services. We proudly run one of the largest scholarship assistance programs in the area at a nonprofit scale, where every year we provide over $100,000 in scholarships to students who are college bound. And awesome. To date, we've invested over $1.5 million in educational scholarships. We also offer career development and training, youth leadership, diversity education, college preparation. We run two major programs focused on public health. One of them is our substance abuse prevention program. We're currently offering this program in 12 different sites throughout Wayne County. And we also have our obesity prevention program, where we teach kids about nutrition and physical fitness education. We offer a wide array of social services, such as hunger relief efforts. We have our annual turkey drive, our clothing drive, and providing basic necessities to income-eligible families and the homeless population throughout Wayne County.
Wow, that's a lot. And we're talking with Wasim Mahfouz of the Leaders Advancing and Helping Communities. And I mentioned the location. It's kind of an interesting background, so tell us about that.
Yes, this is super exciting because back in 2017, we bought a church building, St. Clement's Church, in the east side of Dearborn, and it's a 20,000 square feet space, and we've been under construction for the past 2 years. We recently transformed this beautiful historical building into an office space, and we were honored to have you as our guest there.
It was great.
Thank you.
It was one of the best lunches I've ever had. So we have to do a little bit of a promo for the place that provided the lunch.
Habib's Cuisine.
Yeah. Oh man, it was good.
It was absolutely. So we're very excited about this new location because it's allowing us already to increase the programs and advance the programs and reach out to more people. It's in the middle of a residential neighborhood, so it's at a walk-in proximity to a lot of people. It's very accessible, and we are definitely looking forward to the future and the wonderful programs that we are going to be able to offer and expand.
Yeah, and you also have a very cool community space. That's a big room that you can have community meetings and.
Oh yeah, we do have that. We call it the United Nations Conference Room.
Yeah, that's what it looks like.
It's a very nice place. It can accommodate 100 people sitting down, and it's equipped with technology and sound system and projection. So it's a very useful space for people who want to use it to host large coalition meetings and everything in between.
Yeah, and when I was there with my colleague Therese, that I admired the fact that you were sensitive and respectful to the heritage of the building with some of the things that you kept or at least enhanced. And so, if any parishioners from the former parish are out there, they've done a great job doing that.
Thank you very much. Yes, so we wanted to preserve the history and the architecture structure of the building itself. Even on the inside, we kept the organ pipes and the ceiling, and we wanted to tell the history while serving the purpose of the and the mission of the nonprofit of the community.
That's evolved and changed over the years.
Absolutely.
So you currently are an ongoing partner of the Children's Foundation, and hope that continues for a long time. And so I always like to promote our partners, and in this case, I'm going to ask you to promote the program we're supporting. So if you don't mind telling our listeners about that.
Yes, we were lucky enough to...
We weren't lucky. You're just good at it. So it's not
to have been selected as a proud partner of the Children Foundation. This is the second year in a row we receive a grant to support our obesity prevention program, and this is a wonderful program. It literally stems from a personal experience because I was on the heavy side at one point of my life, and I kind of changed my life, and I wanted to take this experience and start applying it in the community. We go back to the kids and being a father and setting a good role model for other kids and other children in the community. So we piloted this program where we provide nutrition and physical fitness education in local schools. We reach out to kids at a very young age. They're in pre-K and elementary children. So we go out to local schools. We're currently at 25 sites.
Okay, that's a lot.
And we provide them with the basic information related to how to eat healthy, how to stay active, how to limit the screen time, how to eat in a family setting, how to read the labels and the ingredients. We also offer cooking classes for women. And
you have the new kitchen in the building, right?
We do, exactly. Yep. And we also have a very cool program called WOW, which stands for Workout Opportunities for Women Who Don't Have Access to a Gym. And we could have not done this without the support of the Children Foundation, and we really appreciate it.
Well, we're delighted that you're doing it, and we'll do more. And you and I have talked about some other programs that we want to support as well.
Yes.
And so our previous guests, Dr. Brummett and Mario Nanis, are involved in the opioid crisis. And I have to ask, because of the community, you're so close to your community, is there an issue with opioids and addiction in your community?
We do have a major issue in the community that we serve, and this has been a taboo for too many years. Nobody wanted to talk about, and families try to sweep it under the rug, not because they don't want to seek help, but because of the stigma that comes with it. Many families feel that this is going to bring shame to them and they're going to be shunned. So what we do through our substance abuse prevention program is it's a twofold program where we offer prevention education to youth. We go out to local middle and high schools in the area, and we provide them with prevention education. We teach them about the stressors and the leading factors that push someone to abuse substances. It could be peer pressure, decision-making skills, trauma.
Esteem problems.
Self-esteem, absolutely. And we also educate parents and families by providing them with nurturing parenting classes that, mental illness and substance abuse, it's a disease. The first step is to admit that there is a problem. And there is a problem, there is help available out there. We've been losing youth left and right in the community. And this is a very sad situation. Many people don't want to talk about it. And this is what we've been doing for the past 5 years through our substance abuse prevention program, to try to humanize this epidemic, talk about it more, make a lot of noise and around it, and provide the necessary education needed, provide families with the necessary tools that they need to have, connect them with centers that provide intervention, whether they're inpatient facilities or outpatient facilities, and prevention all starts at home.
Well, the nutrition and wellness program that we're supporting is one of our focus areas, as you well know, but certainly the addiction, mental health is another major focus area. So we got to continue those conversations so we can help you do even more. And thank you, Wasim, for what you're doing and for being here today.
Thank you, Larry, for having me.
Great. Coming up next, I'll introduce you to this month's Little Champion and provide an update on some of the Foundation's news. Here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
This portion of Caring for Kids is dedicated to highlighting our Little Champion. The Little Champion program honors children who have overcome a major obstacle in their young lives, and they continue to tackle those challenges each and every day with a big smile. Meet 5-year-old Jackson, one of the bravest little boys we've met. Jackson has cerebral palsy, so he struggles with mobility but hasn't let that stop him. This past July, Jackson also had brain surgery to remove a tumor. The surgery left him with many life-altering complications, but he is facing his challenges with a positive attitude, smiles, and enjoying life as best he can. Jackson is truly an inspiration to everyone he meets. So, congratulations, Jackson, this month's Little Champion. For more information on the Little Champion program and how you can nominate a child, simply visit our website at childrensfoundation.org/champion. Join us again right here on WGR for next month's Caring for Kids. In the meantime, be safe indeed.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.